Hello, if you're watching this video, it means that you're interested in training in mentalization-based therapy. So I'm Anthony Bateman, and I'm going to be delivering the training in October in Guadalajara. Now, just to tell you a little bit about the training, mentalization-based therapy, MBT, is actually an evidence-based treatment originally designed for treating people with borderline personality disorder. It's now, though, used to treat people with different disorders, including antisocial personality, narcissistic personality, and even those with eating disorders and other problems. And all this has been tried in and tested in randomized controlled trials. But the training itself is very clinically orientated. So what we do in the 3 days of training is actually open up the idea of what mentalizing is, so that can help you reorientate your thinking as a clinician a little bit when you're with patients, assessing patients and actually seeing them for treatment. And then we go through the sort of structure of MBT itself and talk to you about bringing the patient into the framework of MBT, which is the introductory phase of treatment, really. And following that, we go through how you can actually deliver MBT in your current clinical practice. So you don't need to change massively in your clinical practice. You can actually bring MBT into your current clinical practice and then deliver treatment to some patients with more formal MBT, if you like. So we train you and get you to think about interventions that improve mentalizing, because the aim of MBT overall is to help someone mentalize better and more effectively. That is, they don't lose mentalizing when they're anxious and when they're triggered. And when they lose it, if they do, which we all do at times, we're able to retrieve our mentalizing capacities quite quickly. Whereas the problem for our patients so often is that they lose it too easily. And when they've lost it, they can't retrieve it. And when they can't retrieve it, they're left with actions and impulsivity, and they're unable to actually get back to a calm mental state. So MBT targets their mentalizing. Now, above all, the training's fun. That I can tell you. We have quite a bit of role play where we play patients, clinicians, and so on. We have video, and we can discuss those videos, and people bring some clinical presentations so we can discuss them from an MBT perspective. And after 3 days, we would anticipate that you would have a pretty good picture in your mind of what MBT is. And you'd begin to be able to use some of the techniques in your current practice, so you could sort of build your confidence with them a little bit. And finally, you could actually, after the training, with some supervision perhaps, and there's a bit of support if you already have that, actually deliver MBT to one of your patients in its more formal way, in a structured interventional process over around 9 months to a year of individual therapy or in group therapy. So do think about coming on the training, and I hope to see you there. And I can assure you we have an interesting and lively time, which is, I hope, leads you to feel much more confident about whether or not you can deliver your therapy effectively to patients who are usually quite severe in their symptomatology and need quite a lot of help. Okay? Thank you very much for your interest.